Welcome back to the Explainer. Back pain. It's something almost everyone deals with at some point. And a really common cause? A lumbar disc herniation. So today, we're going to walk through the whole journey of how this gets treated, from the very first steps right up to some seriously futuristic stuff.
Okay, to really get a handle on just how widespread this is, check out this number. We're talking over 200 million people, and that's just in China, all dealing with issues in their lower back. And a massive chunk of that group? Yep, they've got a herniated disc. It just goes to show this isn't some rare thing. It's a huge global health problem.
So what are we actually talking about when we say herniated disc? Well, the best way to think about it is to picture those little discs between your vertebrae as jelly donuts. Seriously, they're these little cushions. A herniated disc, or LDH, is basically when the outside of that donut gets a little tear, and some of that jelly filling starts to squeeze out. And if that jelly bumps up against the nerve, oof, that's where that sharp pain, the weakness, or that weird numbness comes from.
All right, so this here is basically our map for today. It lays out the entire treatment journey for a herniated disc. You can see how it starts with the simple stuff, the conservative care, and then progresses to more specific therapies, and then, if needed, surgery. We're even going to peek into what the future holds. Let's follow this path together, step by step.
Okay, first things first. Before we get into all the treatments, let's figure out who this is actually happening to. Who's most at risk, and why?
So who's in the hot seat for this? Well, you might think it's all about getting older. And yeah, it's most common between the ages of 30 and 50, but it's really not just about age. Your lifestyle and your job, they play a massive role. Things you might not even think about, like a high BMI, smoking, or having a job that involves a lot of heavy lifting. All of these can seriously ramp up your risk.
All right, so let's get into the treatment path. We're starting at square one, conservative care. For pretty much everyone who gets a herniated disc, this is where the journey begins. And you know what? It's where most people find the relief they're looking for.
And this is really the headline here, the big takeaway. For the vast majority of people, you don't jump straight to surgery, not even close. The body is actually incredible at healing itself. You give it the right support, the right conservative care, and most people feel a whole lot better in just 6 to 8 weeks. That's pretty amazing.
So what about medication? Well, doctors have a few go-to tools in their kit. For that immediate, I need relief now kind of pain and swelling, they'll usually start with NSAIDs. You probably know them, things like ibuprofen. Now, if that's not cutting it, they can bring out the bigger guns, like corticosteroids, for a more powerful anti-inflammatory punch. And hey, sometimes even a simple cream you put on your skin can really help with fewer side effects.
But it's not all about pills, right? Physical therapy is absolutely crucial here. It's a total cornerstone of getting better. And the whole point isn't just to make the pain go away temporarily. No, it's about building a stronger, more stable support system for your spine. We're talking about things like core exercises to get those muscles strong, maybe some mechanical traction to give those nerves a little breathing room, and even things like Pilates to work on strength and flexibility at the same time.
Okay, so what if you've done all that and it's still not enough? Well, that's when you move to the next level. There's this whole middle ground of treatments before you even start thinking about surgery. Let's dive into these more targeted, interventional therapies.
And this is the big question, isn't it? After weeks of doing everything right, what happens if that pain just won't quit? It can be so frustrating. And that's exactly the point where patients and doctors start looking at that next level of care we just mentioned, the interventional therapies.
Now, this is super interesting. We've got two really different approaches here. On one side, you've got epidural steroid injections, or ESI. Think of this as the firefighter. It rushes in with a powerful anti-inflammatory to put out the fire of pain, and it works fast. Great for short-term relief. But then on the other side, you have platelet-rich plasma, PRP. This is more like the construction crew. It uses the growth factors from your own blood to actually go in and repair the damaged tissue. The goal here isn't just relief, it's long-term healing.
All right, now we're getting to the big one, surgery. When does this actually get put on the table? It's obviously a huge step, and believe me, it's not a decision anyone takes lightly. It's really reserved for those cases where everything else has been tried and it just hasn't solved the core problem.
So what are the red flags that point towards surgery? It really comes down to a few key things. We're talking about serious situations here, like if you're experiencing muscle weakness that's getting worse, or a true medical emergency called cauda equina syndrome. Or it could be that after at least 6 weeks of conservative care, the pain is still so bad that it's just destroying your quality of life.
Those are the times you start having that conversation.
And when it comes to surgery, timing can be, well, everything. Check out this number, 97%. For a patient who has that serious muscle weakness we talked about, getting surgery within 3 days can rocket their chances of a complete recovery up to 97%. That's a powerful argument for not waiting around when things get serious.
So if surgery is the answer, what does that even look like today? Because let me tell you, things have changed a lot. We've come a long, long way from the big open surgeries of the past. Now, the name of the game is minimally invasive, super precise techniques that get the job done with way less damage to the surrounding tissue.
This chart does a fantastic job of showing you exactly what I mean. Just look at the different shapes. The red one? That's old school open surgery. Now compare that to the green and purple shapes, which are the modern endoscopic techniques. It's pretty clear, right? The newer methods just dominate when it comes to things like a faster recovery and being less invasive, while still being amazing at getting rid of the pain.
Okay, we've covered the here and now. But what's next? Let's wrap up by looking into the crystal ball at the future of spine care. And honestly, some of the stuff on the horizon is going to completely revolutionize how we do things, making treatments smarter and way more personal.
So what's in this toolkit of tomorrow? It sounds a little like science fiction, but it's real. We're shifting from a remove the problem mindset to an actually repair and regenerate one, using things like stem cells. At the same time, you've got AI helping surgeons plan every single move with pinpoint accuracy, and even predicting how you'll recover. And imagine having wearable sensors that track your rehab progress 24/7. It's a whole new world.
And all of this innovation leads to what is really becoming the new gold standard in care. The idea that you just go see one doctor, that's kind of old school. The best approach now is a whole team, a multidisciplinary team, or MDT. You've got surgeons, therapists, pain specialists, maybe even psychologists, all sitting around a table talking about your case and building a plan that is completely customized for you.
And does this team approach actually work? Oh yeah, the results are pretty staggering. One study showed that when you use a team like this, almost 80% of patients, 80%, got better for the long haul without ever needing surgery. I mean, come on, that's a total game changer for treating back pain.
So this really brings us to the ultimate takeaway here. The future isn't just about finding a cool new treatment, it's about finding the right treatment for you. We are absolutely leaving the one-size-fits-all era behind. With all these tools, the AI, the regenerative medicine, the care teams, it's all pointing in one direction. We're not just entering the age of personalized spine care, we're already here.